For the group of patients that are happy with the shape of their breast but simply want to enlarge their breast and have more cleavage and a bigger size to complement their figure, we talk about breast augmentation. This operation can be performed using different approaches or incisions. Commonly in our practice, we use an incision in the armpit area. Other options include an incision under the breast or on the edge of the areola, which is the dark skin that surrounds the nipple. We use both saline and silicone implants depending on the patient's desire and what we feel would work out best for them. When we talk about the specific operation for breast augmentation, one of the things we explain to patients is that breast implants, no matter where we make the incision, are either placed under the chest muscle or on top of the chest muscle. And the muscle we're referring to is the pectoralis muscle, or your pecs. In order to get a good result with an implant under the muscle must be supple and soft enough to stretch and cover the implant. The reason for using a submuscular implant would be to hide the edge of the implant, which is much more important in a saline implant than a softer silicone implant. One reason we might choose to go on top of the muscle is that it leads to a much quicker recovery. There's less invasiveness to the surgery when we go on top of the muscle, and there's less distortion of the implant itself if we go on top of the muscle. Another important consideration is cleavage. If a patient has very wide set breast and is seeking to achieve as close a cleavage as possible, it's better to go on top of the muscle with the implant. And for that reason, we'd probably choose silicone because it looks soft and natural on top of the muscle. The operation is done in our operating facility in our office and typically is done within 1 to 2 hours, followed by an hour of recovery time, after which the patient can go home. Most patients are completely recovered and able to return to work in a week. We, however, ask that they wait 3 weeks before they involve heavy lifting or strenuous work or exercise at the gym.